Okay, one more time. One more this week anyways. This is Sherry again. We are now on drug interactions and over-the-counter drugs. That is the last one for this week, the last lecture. I look forward to hearing from you. Tell me whether or not this is helping or not. So if it is, I'll keep it up. If not, not so much. Alrighty. If you can notice, I also changed the venue a little bit. I got a new toy, so I'm trying it out. If I thought I might have some hearing problems with it when I replayed it back, let me know. If there are, I'll be sure I won't do this anymore. So anyways, okay, let's get on with it. This is drug interactions and over-the-counter drugs. Clients are at high risk for interactions with those that have chronic health conditions. Take multi-meds, see more than one doctor, you know how that is, doctor shopping, and use more than one pharmacy, which is not good because the pharmacist needs to be able to have interaction to tell whether or not you're on drugs that might not work well together. Elderly are 75% of who are taking prescriptions in the country today. More than 80% take over-the-counter meds so that they are at the really high risk for drug interactions. And if you're not letting the pharmacist and your physician know that you're taking over-the-counter meds, there's a real problem. Drug interaction is defined as an altered or modified action or effect of a drug as a result of the interaction with one or more drugs. Drug incompatibility is a chemical or physical reaction or an effect of a drug as a result of taking more than one drug. Drug incompatibility, on the other end of it, is a chemical or physical reaction that occurs among two or more drugs inside or outside the body, like in the syringes or in the IV bags. So let's back that up and say that one more time. Drug interaction is inside the body, okay? That is the effect or the altered or modified action of two drugs within the body and how they react with each other. Whereas a drug incompatibility is a chemical or physical reaction that occurs among two or more drugs in vitro, which is outside the body. Just so you understand that. Like if you pull up two drugs within a syringe or two drugs within an IV bag. So just kind of think about that. All right. Pharmacokinetic interactions are changes that occur within the absorption, the distribution, the metabolism, or the biotransformation and excretion of one or more drugs. And that's what we've been talking about this whole time. If two meds are taken at the same time, the rate of absorption of one or both of them can be changed. One can block the drug, the other can decrease it, or it can increase the absorption rate of the other. So that's something to be aware of. There's been a huge increase in the number of drugs available within the country over the last 20 years. So you have to think about the interactions between drug to drug, drug to food. All of this is very, very important. The pharmacokinetics and the pharmacodynamics are the changes that occur within the absorption, the distribution, the metabolism, and that bioavailability. Also within the excretion, like I said before. So you got to think about the absorption. Two drugs at one time, and both drugs can be affected. Also, there's either an increase or a decrease in the gastric emptying of that drug. Your pH, there's changes in the pH within the system, and that can form another drug complex. All of this is really important to pay attention to. In the distribution, binding of the plasma or the serum proteins, only one unbound drugs are free agents. So think about that. Unbound drugs, unbound protein drugs are free agents within the body, and they can enter body tissues. If they're still bound to the proteins, they can't enter the tissues. So think about that. If you give two drugs that are highly bound compounds, they compete for the same site. The result is that there is a decrease in the protein binding of one or more of the drugs. Therefore, there's a lot of free drugs circulating around there in the system that can be used. Similar acting drugs, they can interact. This is called either desirable interactions or undesirable interactions. For example, Lasix and a beta blocker, they'll give those two together and it decreases hypertension. That's desirable, as compared to hydroxyline and nitroglycerin that may be given for hypertension, but it may cause an undesirable effect, a huge drop in the blood pressure. So these are how they can interact with each other. In the metabolism, that's your biotransformation. An example of barbiturates and enzymes, they both increase warfarin. What do I want to say here? I'm sorry, I'm stuttering. Anyways, drugs that stop your convulsions, it increases your metabolism. So you need a large dose. If you take those drugs, you need to have a larger dose because they can be interfered with. Excretion, your drugs that decrease cardiac output and decrease blood flow to the kidney. Any drugs that decrease the cardiac output decrease the blood flow to the kidney. They decrease urine output, glomerular filtration. Those are all, you have to think about it. So they may stay in the system longer. Antagonistic, we go ahead and skip on down there. Let's talk about synergistic drugs and their potentiation. So when you have something that's synergistic, what is happening is that there's a greater effect of the outcome of the drug or the effect of the drug with the two drugs together as compared to if either one or the other was given. For example, say you're giving maybe some Tylenol, so they combine it with an opiate. So therefore you get a better pain relief with that med than you would with either one or the other. Another drug to think about is quercetin. Quercetin is a combo drug, and you get a better effect from that than you would with just the drug alone. And an antagonistic drug effect, that means that you'll get the opposite effect of what the drug was doing. So it cancels out the other one. And an example of that, of course, is Narcan. If you take an opiate and you're like sedated and very sleepy, not breathing very well, to give Narcan, it is an antagonist to that drug, and so therefore you get the opposite effect. On your next slide there, you've got drug interactions. Drug interactions are your drug and food interactions, drug laboratory interactions, drug-induced photosensitivity, and a lot of the over-the-counter situations there. Of course, with your drug-food interactions, it depends. You're going to either get a higher increase of absorption or less, depending on whether this drug needs to be taken with food or it needs to be taken on an empty stomach. Your drug laboratory interactions, those are things that are like digoxin. Is your potassium and your sodium low? Your potassium and your magnesium low? Or is your calcium high? All of these are effective on digoxin, and therefore you may end up with a toxic result. Your photosensitivity. Some drugs you take may make you photosensitive, and there's a chance of cellular damage, so you have to be aware of that. Over-the-counter drugs also are categorized on safety and whether or not they should be used. Over-the-counter drugs, category 1, have been listed as safe and effective. And let me just back up here a moment, because more than 90% of illnesses we treat as a nation, we treat by over-the-counter drugs. We take those before we ever go to the doctor. So then they have listed these, whether or not they're safe or not. Category 1 drugs, over-the-counter drugs, are considered safe and effective and can be used as labeled on the medication. Category 2 drugs, now those have been listed as safe and ineffective, and they should not be used in non-prescription products. These have to be reformulated and then be represented back through the FDA to try to get a Category 1 data on those. And of course, Category 2 there's insufficient data there whether or not to even judge those. Some of the other things that happen with the over-the-counter drugs is you have to be aware of their cautionary facts. Like over-the-counter cough and cold medicines, they're primarily safe for children greater than 6 years old. But children that are 2 to 6, you need to talk to your healthcare provider first and decide whether or not that's a good drug for your children or for your clients. If they're less than 2, you should never give them any over-the-counter cold or cough medicines. That's just the statement that is out. There's been too many deaths with that. Over-the-counter sleep aids, most of them are usually either aspirin or Tylenol, and they have a antihistamine component to them. And they are never to be given to children, and use a lot of caution in the elderly with those. And you know there's a lot of weight control medications out there as over-the-counter. Most of these have an amphetamine component in it, and doing that, it can increase your cardiac output. You have a increased, like a tachycardia. You can have an increased hypertension. So if you're a hypertensive anyways, you wouldn't want to take those. They can have issues if you're a diabetic. They also affect your thyroid. The first FDA approved over-the-counter medication to help with weight control was orlistat. I'm sorry, I said that wrong. Orlistat. I'm sorry, that's how you say it. Orlistat. Anyways, it inhabits lipase enzymes in the GI tract. It's only for adults greater than 18 years old. It blocks dietary absorption of fat by 30%. There are troubles with that. Of course, then you tend to have more fatty stools. So there could be a chance of some diarrhea there, and patients need to be aware of that. Clients need to. Cautions with use of over-the-counter meds. There's a delay in professional diagnosis and treatment. So the patient, instead of going straight to the doctor, they go ahead and go to the, just try to take care of it themselves. And a lot of the symptoms can be masked because maybe it makes them feel just a little bit. Maybe they have the flu or a cold or maybe even pneumonia, but they're going ahead and taking the over-the-counter medicines, and it is masking some of the symptoms. You must always encourage all your clients to always read the labels. There are right on the labels do's and don'ts of taking any of these medications. It is best to always consult your healthcare provider before you even begin using, especially if you have other comorbidities like diabetes, hypertension, etc. You always should consult your healthcare provider. Inactive ingredients that are put into the medication just for either storage life or other issues may cause adverse reactions, and those need to be accounted for. So another reason why you need to call your healthcare provider and just go over it. There's also the potential for overdose. If a little bit is working well, then a lot will work even better, but that's not a good practice. And the intentions of the mixing of the prescription drug and the over-the-counter medication. You should never, and tell your patients this, do not take over-the-counter drugs with your prescription drug without talking to your healthcare provider first. Okay, that's a quick down and dirty. Hope you got it. Practice question number 1. The major ingredient in many over-the-counter products is phenylpronol Liming. Say that fast. Anyways, you can look at your slide and say that correctly. Which is contraindicated for clients with the following conditions? A, heart disease, B, thyroid disease, C, diabetes, and D, kidney stones. The answer to that is D. If you have kidney stones, because it just will make them worse. Alright, question 2. What good sources would you recommend to a client for information about over-the-counter drugs? Well, the best one, the pharmacist and his book, will always say, The Handbook of Non-Prescription Drugs and Facts and Comparisons. All right, that's the end of week 1. I hope you're staying up to date, and I hope you did well. Call me if you have any questions. I'll talk to you soon. Bye.